Okay, the next item of business is a statement by Neil Gray on winter preparedness and national planning priorities for health and social care. The Cabinet Secretary will take questions at the end of his statement, therefore there should be no interventions or interruptions. And I call on Neil Gray, Cabinet Secretary, up to 10 minutes, please.
Presiding Officer, thank you. Earlier this year, we published our Operational Improvement Plan, Service Renewal Framework and Population Health Framework, which set out the short, medium and long-term actions we will take over the next 10 years. Fundamental to our approach is giving greater control to those who understand our NHS and social care system best, the committed workforce that runs these services every day. Our focus on winter this year is very much in line with this, supporting services to plan for winter pressures in a way that best suits their local circumstances, whilst ensuring consistency across the country through nationally agreed priorities and principles. However, today does not represent the start of our winter planning. On the contrary, we have been working since last winter to learn lessons and support NHS boards and social care partners to plan their own preparedness and response. We have worked with partners in both the NHS and COSLA to agree local plans underpinned by our national principles, and I am pleased today to share these more widely with the publication of our national planning priorities and principles for surge and winter preparedness in health and social care. This document builds on experience of previous years and sets out what matters most. That is prioritising care for those who need it the most, taking preventative measures to keep people well, ensuring people receive the right care in the right place at the right time, supporting the mental health and well-being of the workforce, and maximising capacity by improving patient flow and access, reducing delayed discharges and tackling long waits. These principles ensure people continue to receive high-quality care even whenever demand increases, not just for winter but year-round. This includes periods of surge demand, whether due to respiratory viruses, heat-related illness or major local events. Every year when the temperature drops and winter arrives, viruses such as the flu are a concern. As this year's winter vaccine marketing campaign reminds us, for some, winter flu hits harder, and flu can be extremely serious. Whilst it is too early to know for certain what the dominant flu virus strain will be this season or how this season will evolve, I am paying very close attention to that data. With cases starting to rise and emerging evidence suggesting that this may be another particularly difficult flu season, I urge all of those who are eligible to come forward and make it a priority to get protected, no matter what. Vaccination remains our best defence and one of our most important preventative public health interventions. Almost everyone eligible to receive their winter vaccinations should now have been contacted with a prompt to book for an appointment. For those who are eligible but have not yet heard, I encourage you to check the NHS Inform Winter Vaccines page for more information. Members will remember, during the peak of the season last year, we saw emergency hospitalisations increase significantly, with more than 6,500 adults admitted to hospital as a result of flu. And this year, given the early rise in cases in children and teenagers, I want to specifically encourage parents and carers to support children to take up the offer of the vaccine when it is offered to them at school. This is also vital to help prevent transmission of the virus to older or more vulnerable family members and friends. Contrary to what we have heard in some quarters, vaccines are safe, they are effective and they save lives. And I ask for the support of colleagues across the chamber today to reinforce this message. Presiding Officer, the readiness of our services to respond to winter is closely tied to the progress that has been made to strengthen our NHS. Waits, particularly those waiting over a year, are coming down consistently for the fourth month in a row. I know that there are some in this chamber who seek to suggest that we are not making progress, but this does a disservice to our incredibly hard-working NHS staff, whose efforts mean our NHS is turning a corner and is delivering tangible improvements. We are also treating more people, with more than 31,000 extra appointments and procedures from April to September compared to the same period in 2024. Diagnostic backlogs are being tackled by increasing capacity through enhancing radiology services and mobile scanning units to deliver 95% of referrals to be seen within 6 weeks by March 26. We're expanding hospital-at-home beds to 2,000, making it Scotland's largest hospital. We've increased access to front-door frailty services in accident emergency departments, improving patient flow and outcomes. I saw this firsthand on my recent visit to Dumfries and Galloway Royal Infirmary's acute frailty unit, where the average hospital stay for those admitted to the unit is now 3.4 days, compared to a typical 17.5 days average hospital stay for older, frail patients. We're also rolling out a theatre scheduling tool, which is increasing operating theatre productivity by up to 20% for some specialties. And we're seeing progress in urgent and unscheduled care. We are working closely with both NHS 24 and the Scottish Ambulance Service to ensure they are as resilient as possible ahead of winter. Following a £5 million investment, NHS 24 has implemented new call centre and clinical support systems, which are bringing benefits and efficiencies for both patients and staff. Over 90% of eligible ambulance requests are now transferred digitally by NHS 24, eliminating manual transcription, reducing errors and significantly speeding up the process for patients. And I'm pleased to confirm that the Scottish Ambulance Service will recruit more than 290 new frontline staff this year, including newly qualified paramedics and ambulance care assistants, some of whom I had the great pleasure of meeting when I visited their Queensferry contact centre earlier this week. Presiding Officer, to ensure a resilient system which can adapt to the challenges that we face requires a collective effort. That's why I am pleased to confirm today that I am also directing boards to take a new sub-national planning approach to some key priorities on digital care, on business systems, on emergency access standards and on orthopaedic elective services. I expect boards to work together to achieve a significant and measurable impact for patients and communities. This will see us optimise the capacity that there is in our system, and in doing this, I want to ensure there are no barriers to boards working collaboratively to deliver high-quality, safe and effective care to patients and communities across Scotland. Whilst board geographical boundaries and current accountabilities will remain, there will be new expectations around the structured sub-national planning and delivery. To deliver this, NHS boards are now putting in place two subnational planning structures, one focused on the east of Scotland and one in the west of Scotland, building on the good joint working already in place. This is about ensuring the same high-quality care is provided, no matter where someone lives, and particularly how we ensure the unique needs of our Highland, rural and island communities are being met. There will also be a vital role for our special health bodies in engaging and supporting this new planning approach, and I have been clear that I expect trade unions to be engaged as this work develops. Indeed, our workforce will be pivotal in ensuring this approach to service planning brings improvements both for staff and patients, and I look forward to engaging with staff-side colleagues on the effective implementation of this approach when I meet them next week. Finally, I want to turn to social care, Presiding Officer. I recognise our response to winter must be a whole-system one, and our social care sector has an incredibly important role to play. I acknowledge the real challenge facing the sector at the moment, not least the UK Government's increase to employer national insurance contributions, costing social care providers £84 million, and its increasingly harsh and restrictive approach to international social care workers. I also acknowledge the historic and systemic issues facing the sector when it comes to funding and structure. Whilst investment has reached record highs, Scotland's adult social care sector faces its strain. There is much more work to do in the longer term, and I reiterated this when I met with COSLA's spokesperson for Health and Social Care, Councillor Paul Kelly, yesterday. I don't shy away from this, neither does he. However, we know that the sustained pressure on the system exacerbates over the winter months, and I'm determined to ensure that pressure is relieved as much as possible. That is why I can confirm today that we have identified up to £20 million to bolster social care capacity and support front-door resilience in the areas where need is most evident. This funding will be delivered through health boards to build on the examples of success we have seen in NHS Lothian and NHS Forth Valley, where sharing resource across the health boards and health and social care partnerships has delivered significant improvement. Investing in social care is not only the right thing to do, but will help reduce hospital admissions and ultimately relieve pressure on our NHS acute services. Presiding Officer, the measures I have outlined today represent only a small slice of the vast amount of work underway already. While I have outlined some of the real progress we have made so far, I am committed to providing a more comprehensive report for the end of this parliamentary session. This will include reporting on progress against our operational improvement plan, service renewal framework and population health framework, as well as a final report against our NHS recovery plan 2021 to 2026. Taken together, this will demonstrate how we have progressed recovery from the huge impact of the pandemic and how we are modernising our NHS and social care services for the years ahead. I thank our dedicated NHS staff, who I know will continue to work tirelessly in the coming weeks and months, and I will continue to ensure that we are prepared not only for this coming winter, but all year round.
Thank you, Cabinet Secretary. The Cabinet Secretary will now take questions on the issues raised in his statement. I intend to allow around 20 minutes, after which we'll need to move on to the next item of business. I encourage members wishing to ask a question who haven't already done so to press the request to speak buttons. I call first Brian Whittle.
Thank you, Presiding Officer. Can I thank the Cabinet Secretary for advance sight of his statement? Presiding Officer, Christmas will be on the 25th of December this year. Hogmanay will be on the 31st. And I just mention this to the Cabinet Secretary because, given the lateness of this statement, I could only assume the Scottish Government had somehow missed that winter typically comes around once a year after autumn. And if they can miss that, who knows what other annual events might sneak up on them. Presiding Officer, last winter was one of the toughest Scotland's NHS has ever faced. This year looks set to be worse. Patient waits for ambulances can be measured in hours or days, not minutes. Delayed discharge is still a massive issue, a decade after the SNP pledged to end them, and 1 in 6 Scots are on a waiting list. The Scottish Government has announced more funding for GPs, but that's in future years and won't come close to the cuts that have seen GPs' share of NHS funding fall from 11% to 6%. It announced walk-in GP clinics, but the location of the first one hasn't been chosen. This year's flu outbreak is predicted to be one of the worst in years, but vaccination rates amongst healthcare staff fell to 35% last year. Members of the public being offered flu and COVID jabs have been told health boards they won't be getting them until well into December, despite cases of both these viruses already being on the rise, hardly pointing to any level of preparedness. So, Cabinet Secretary, how do you propose to properly fund primary care and get more people vaccinated more quickly? And does he accept that it might have been better if he'd woken up to these entirely predictable issues before November?
Cabinet Secretary.
Presiding Officer, on the timing, the statement that I bring to Parliament, as I said in my statement for which he had foresight of, is not the start of the process in terms of winter planning. This has been underway for months. Indeed, as I said in my statement, it began last winter when we learned lessons from the situation that he has described around the seriousness of last winter being so difficult because of the unprecedented spike in flu that we have seen last year. That's why the work that we have done around vaccination leading into this year is so important, why the marketing campaign is directed the way it is, why we are explicit in our messaging around ensuring that people who are eligible are getting access to the vaccination programmes and ensuring that we're supporting parents to do so for their children as well. Mr Whittle references investment in primary care and GPs. It gives me the opportunity to say that the investment that is coming is the single greatest increase in investment in general practice that has ever been delivered here in Scotland. That has been done by negotiation and consensus with the Scottish Committee of General Practitioners in the BMA and the Royal College of GPs. We haven't waited for that. We have increased investment in general practice this year as well. And that is because we recognise, as I know Mr Whittle does as well, the need to shift the balance of care, move to a more preventative approach, and that starts with primary and community care that's led by general practice.
Jackie Bailey.
I thank the Cabinet Secretary for his statement, but it is 2 months later than it was last year. He knows that every day counts. A mutated H3N2 flu is heading this way. It's devastated Australia, it's closed schools in Japan, and it's surging in India and mainland Europe. The flu season has already started, more than 5 weeks early, and vaccination rates are down. There are 400,000 fewer adults vaccinated now than there were this time 2 years ago. Children's vaccination rates are also down, and some areas have not even started. In the Highlands and Islands, GPs were promised that they would be able to deliver vaccinations to increase take-up rates, but nothing appears to have happened. Today, the Cabinet Secretary and I attended an RCN conference where we both spoke about the importance of prevention rather than crisis-driven, sticking plaster approaches so common to this government. So can I ask the Cabinet Secretary, by not delivering vaccinations at pace and scale to protect the population and protect our NHS from winter pressures, has he not failed at the first hurdle of prevention?
Cabinet Secretary.
First of all, I recognise the potential prevalence of H3N2. I've received a briefing on that from the Chief Medical Officer alongside the First Minister earlier this week. It's too early to say as to whether or not that is going to be the dominant strain this year, but I do also recognise the points that Jackie Bailey has made around the impact that that has had elsewhere in the world. And that's also why I've pointed to, in my statement, which I hope she will reiterate in her own communications, the need to ensure that we are asking people to take up their vaccination appointment. I expect everyone should have received an appointment who is eligible now. If they haven't, they should contact NHS Inform and seek the advice that they need to. And I would encourage everyone to ensure that they take up the vaccine, including enabling parents enabling children to take up the vaccine, because we know that this is initially been most prevalent within children and teenagers. So in order to stop the spread, to become more critical to our adults, as we saw earlier last year, we need to make sure that that immunity is provided. And that is exactly what we're investing in across Scotland.
Thank you. Rona Mackay, to be followed by Liam Kerr.
Thank you, Presiding Officer. I recognise the importance of the Scottish Government Hospital and Home Services, which prevented 15,470 people spending time in hospital in 2024-25. And I note the Cabinet Secretary referenced the use of frailty services in A&E wards. These services are crucial during the colder periods, so can the Cabinet Secretary outline how the Scottish Government will ensure the work of these services are supported and enhanced going forward?
Cabinet Secretary.
Then, Officer, I thank Rona Mackay for her question. She's absolutely right. We've made strong progress to ensure every health board now has a frailty service in A&E departments. Implementation is at different stages, and all boards continue to develop their services, which will particularly help older patients with average length of stay reduced by around 14 days and no increase in readmissions. We've been speaking about the preventative approach that we need to shift to. This is exactly the type of preventative approach that is proven to work. And we're also on track to deliver 2,000 hospital-at-home beds by December of next year, and we're shifting that balance of the care from acute hospital-based settings into the community, right into people's homes whenever possible, ensuring people get the right care in the right place at the right time, and that's underpinned the £200 million of our record funding into the health service.
Liam Kerr, to be followed by Christine Graham.
NHS Grampian is already in crisis. Despite the best efforts of hard-working crews doing their absolute best, average emergency ambulance turnaround times at ARI are now almost 2 hours, and 1 in 10 are stacked for over 4 hours. That is in the context of a £68 million overspend this year. Yet, incredibly, neither the Cabinet Secretary nor his overdue plan even mentions NHS Grampian. So what precisely will the Cabinet Secretary and his overdue last-minute plan do to guarantee ambulance response times won't get even worse for the people of the North East this winter?
Cabinet Secretary.
Presiding Officer, I met directly with ambulance service staff last month when I visited the ARI. I heard directly from them the concerns that they have, and also the incredible work that's been done by the Halo staff at the front door of our hospitals. I pay tribute to them for that work. I'm also impressed by the work that's been taken forward by ambulance service colleagues and by our unscheduled care leadership within Grampian in order to come forward with that improvement plan for NHS Grampian. That is being overseen by the Oversight Board, the Assurance Board that is relevant to the escalation that NHS Grampian is under, and we have committed additional funding to NHS Grampian for its unscheduled care pathway work.
Christine Graham, to be followed by Paul Sweeney.
Thank you, Deputy Presiding Officer. Cabinet Secretary, approximately 1 in 3 people over 65 in Scotland fall each year, while about half of those over 80 fall at least once a year. Falls are the most common reason for an ambulance to be called for an older person, and they are a leading cause of unintentional injury hospital admissions. In winter, slips on untreated pavements increase falls, but the cost to the NHS and ambulance service, A&E, hospitalisations and perhaps afterwards social care can be reduced. Gritting pavements is the responsibility of local authorities, but would the Cabinet Secretary give consideration to authorising NHS boards to provide funding to a local authority specifically to help them grit pavements? Because I have no doubt that would prevent at least some falls, all with a cost not just to the individual's health but to the public purse.
Cabinet Secretary,
why not pilot it to see if...
Cabinet Secretary.
Presiding Officer, I absolutely agree with the premise of Christine Graham's question. She's absolutely right that slips, trips, falls account for a significant reason as to why we have increased admissions to hospital over winter. I can give her assurance that part of the reason as to why this is a plan that is jointly published with COSLA is because we recognise that there are many of the drivers of poor health and admission into our health system that are the responsibility beyond the health service, including, as she points out, the gritting of pavements and ensuring walkways are cleared. It is something that I'm more than happy to continue my discussions with COSLA colleagues on to ensure that they are taking those responsibilities seriously.
Paul Sweeney to be followed by Claire Hawley.
Thank you, Deputy Presiding Officer. On Saturday morning, I spoke to a nurse who had just finished her night shift at Glasgow Royal Infirmary's A&E department. She said that the corridors in that A&E department are already filling up with elderly patients stuck on trolleys, unable to be admitted up to wards, and that she and her colleagues are terrified that this situation is only going to get worse as the winter deepens because it's only mid-November. From conversations she's had with colleagues from other hospitals, she knows that corridor care is the norm in many hospitals across Scotland. So will the Cabinet Secretary give a personal guarantee to my constituent and her colleagues at Glasgow Royal Infirmary that this winter preparedness plan will finally end the disgrace of corridor care in Scottish hospitals?
Cabinet Secretary.
I thank Paul Sweeney for his question. I pay tribute to the work that has been done by his constituent and many others, not just in Glasgow Royal Infirmary, but across NHS Greater Glasgow and Clyde and across the health service in Scotland. Corridor care is not, as Mr Sweeney will know, a phenomenon solely focused here in Scotland. It is a challenge that is facing all hospitals. I've got family members in the north of England that see a very serious situation with that at present. That's not to say that I don't accept the challenge that is here. Of course I do. I see it when I go out. I hear it from staff. I do not accept it as either an inevitability or a norm. It is one that we must tackle, and that's why I'll work with our staff and health boards to ensure that we see improvements happening.
Claire Hawkey to be followed by Maggie Chapman.
The ambulance service is a vital component of emergency care throughout the year, but particularly in winter. And Scotland is not unique in the pressures facing ambulance teams. And I know under the Labour government in England that the Category 1 and 2 ambulance response times in September were the slowest since February, whilst Category 3 and 4 response times were the slowest since December 2024. However, I welcome the steps the Cabinet Secretary has announced in his statement to shore up Scotland's ambulance service, and I welcome the news this week of an increase in the number of call handlers for the service and NHS 24. Can the Cabinet Secretary outline how these changes will bring benefits for patients over the winter months?
Cabinet Secretary.
Presiding Officer, Claire Hawkey puts on the record important context around the challenge that has been faced in all parts of the UK, despite what Labour colleagues here may say. As I set out in my statement, we're increasing investment to strengthen both the Scottish Ambulance Service and NHS 24 ahead of winter. More staff will help address capacity challenges, improve care for those needing urgent treatment and ease pressure on accident and emergency. Additional roles in the ambulance service's integrated clinical hub mean more patients can be treated without unnecessary hospital visits, freeing up crews for life-threatening emergencies. Likewise, new NHS 24 recruits will reduce call handling times, manage rising demand and enhance clinical supervision, ensuring faster, safer triage for patients. We have, of course, also significantly increased the number of paramedics in recent years, and these changes will deliver tangible benefits for people across Scotland during the busiest months, and I pay tribute and thanks to our Scottish Ambulance Service staff for the work that they do.
Maggie Chapman to be followed by Alex Cole-Hamilton.
Thank you. The winter period will place extra pressure on unpaid carers as well as paid staff. I note that the Surge and Winter Preparedness document states that support for the well-being of carers should be embedded in surge planning. Can the Cabinet Secretary provide more detail about what that support should entail and how unpaid carers can find out what extra assistance they may be entitled to?
Cabinet Secretary.
I thank Maggie Chapman for raising a critical issue, one that all of us as representatives know well the critical role that our unpaid carers play. In my area, the Lanarkshire Carer Centre provide phenomenal advice and support to local unpaid carers. I expect those types of services locally to be able to pass on the type of advice and support that Maggie Chapman is looking for, and I'll ensure that I provide further detail on where those services are in writing to Ms Chapman following this statement.
Alex Cole-Hamilton, to be followed by Fulton McGregor.
Thank you, Presiding Officer. Presiding Officer, this morning the Cabinet Secretary and I both attended a conference organised by RCN for nurse activists. He will remember the moral injury that is etched into the faces of the nurses at that conference, caused by things like corridor care, not being able to provide timious support to patients, some of whom have been languishing on waiting lists, along with 800,000 of our fellow Scots. Does he recognise that for as long as 2,000 Scots are stuck in hospital, well enough to go home, but too frail to do so without investment in social care in our communities, either a care bed to receive them or a package to bring them home, that problem will only get worse as the winter months draw in?
Cabinet Secretary.
I accept the premise of Alex Cole-Hamilton's question, and as I did at the RCN conference this morning, as I did at the RCM, the Royal College of Midwives conference later on this morning, I set out my gratitude to the staff for the work that they are bringing forward. I want to make sure that I address the challenges that they raise, but also celebrate the remarkable contribution that our staff deliver, because too often their contributions and their individual innovation and service delivery often go unnoticed to the detriment of their work in favour of outlining the challenge within the system only. In terms of moral harm and moral injury, the best way that we can address that is by improving access to our health service, reducing waiting times. We are turning a corner in that regard thanks to the investment in the budget that Mr Cole-Hamilton supported and the incredible endeavours of our staff. I agree with him with regards to the situation with regards to delayed discharge and social care. That's why, in the statement, I've ensured the allocation of additional resources going into social care.
Fulton McGregor, to be followed by Finlay Carson.
Thank you, Presiding Officer. The recent media reports about the upcoming flu season are very concerning indeed, as outlined by the Cabinet Secretary. I wonder if he can advise the measures that will be taken to ensure a high level of uptake in flu vaccines as we approach the colder weather, where the flu becomes more prevalent in our communities, and what more can members across this chamber do to encourage uptake within our communities?
Cabinet Secretary.
Presiding Officer, I thank Fulton McGregor for allowing me the opportunity to again put on the record the importance of vaccination in our preparedness for winter. Experts in Public Health Scotland and the Scottish Government are monitoring the situation regards flu closely, but vaccination remains the best protection against flu. Not just my message, the message of experts is clear. Everyone eligible should come forward for their vaccination. We're working with health boards to make access easy and convenient, supported by a national campaign and engagement with trusted community voices to highlight the seriousness of flu. I've also written to all NHS chief executives and social care providers in Scotland, in consort with the Chief Medical Officer, to ask them to set out how they are ensuring health and social care workers are being supported to get vaccinated. And digital reminders have also been introduced, and health and social care staff are receiving prompts to get vaccinated. Boards are also offering drop-in clinics and appointments that can be booked in any health board area, making it simpler for people with busy lives.
Finlay Carson, to be followed by Stuart McMillan.
Presiding Officer, like you, the Cabinet Secretary for Health is understandably proud of his Orkney roots, and he often mentions it when he explains how he understands rural issues. So you can understand my surprise and disappointment that the national planning priorities make no explicit mention of rural health challenges. Across health and social care in Dumfries and Galloway, it's dealing with a combined funding gap of £58 million. Given this and the unique pressures in areas like Dumfries and Galloway, such as workforce shortages, long travel times and limited access to specialist care, how will the Cabinet Secretary ensure that rural communities are not disadvantaged? And how will he ensure that the new planning structures to optimise capacity in practice address the distinct needs of rural and remote communities, rather than focusing resources focusing resources on urban centres where economies of scale achieve.
Cabinet Secretary.
Finlay Carson is absolutely right. And in the discussions that I've had with colleagues on moving to a sub-national planning structure for planned care activity, for instance, I have been absolutely explicit that I expect there to be a support for rural and island communities to ensure that they are being treated equitably. I do not expect our system to move forward in a situation that sees only transportation happening in one direction. I think NHS Highlands National Treatment Centre is an evidence of people travelling from the Central Belt to a Highland resource, demonstrating the fact that we are looking to ensure that there is better equity in both the provision of healthcare and who we're expecting to travel where.
Please, Stuart McMillan.
Thank you, Presiding Officer. The Cabinet Secretary will share my concerns at the pressures facing Scotland's social care sector this winter. Pressures that really have been exacerbated by Labour's increase to national insurance contributions. We all know that social care workers play an invaluable role in our communities. So can the Cabinet Secretary therefore outline what steps the Scottish Government is taking to ensure NHS boards improve flow from hospitals to social care settings, and what additional support has been put in place to support the social care sector? As briefly as possible, Cabinet Secretary.
Presiding Officer, social care providers face real financial pressures from the UK Government's increase to employer national insurance contributions, as Stuart McMillan has highlighted. That's expected to cost the sector an additional £84 million. And this, coupled with workforce shortages across the care sector, being exacerbated by a significant decline in the number of health and care visas being granted by the Home Office, a 77% drop in the year to the June 2025. We are working closely with partners to understand the impact of these issues, identify further mitigating actions and, at the same time, improving hospital flow, reducing delayed discharge, and that is absolutely critical. So the money that we are announcing today will be targeted at those local systems most in need to deliver faster discharge and better integration with social care. Alongside this, record funding of £15 billion for local authorities in 2025-26 will help to strengthen resilience.
Thank you, Cabinet Secretary. That concludes this item of business. There will be a brief pause before we move to the next item of business to allow front benches to change.